Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, and as a part of the continuing medical education program, as well as a health awareness to the public, I'd like to dwell on this important topic today, the 7 top strategies to prevent a heart disease. The first and most important is avoid smoking, very important. One of the best things you can do for your heart is to stop smoking. The chemicals in the tobacco or even the smoke can damage the heart and the blood vessels. There are several poisonous compounds that are involved in the smoke, which if inhaled will damage your lung. Cigarette smoke reduces the oxygen in the blood, which increases blood pressure and the heart rate, because the heart has to work harder to supply enough oxygen to the body and brain. After a year, now you find as soon as you quit smoking, the immediate effect is the risk of heart disease starts to drop in as little as a day after quitting. After a year without cigarettes, the risk of heart disease drops to almost half that of a smoker. No matter how long or how much you have smoked, you will start reaping the rewards as soon as you quit smoking. Very, very important. So, avoid smoking. The second one is get moving. Don't remain idle. Get moving. When you say get moving, it is more of activities. At least aim for at least 30 to 60 minutes of daily activity. It can be walking. I feel after the age of 45 or 50, the best activity is walking. So half an hour in the morning and half an hour in the evening, or 1 hour in the morning and 1 hour in the evening, it will be quite good. You can actually walk, which will in fact reduce your blood pressure, cholesterol, even prevent in fact type 2 diabetes, or even if there is diabetes, it will help to control the diabetes. Even shorter bouts of activity after health minutes, it's just not only walking, you can even be 5 minutes of moving, like gardening, housekeeping. That itself is some activity and you're doing some exercise. Taking the stairs instead of the elevator or the lift, and walking with the dog. Yes, anything what it is. All these are small activities, just not enough that you have an organized walk every day, but you can have other activities also. And all these have got a lot of benefits, and especially it controls your blood pressure, it controls your cholesterol, and even it controls your blood sugar level. So get moving, aim for at least 30 to 60 minutes of activity daily. The third one is eat a healthy diet. When I say a heart healthy diet means consists of vegetables and fruits, beans and other legumes. For non-veg, lean meat that is without fat, as well as fish maybe twice or thrice a week, low fat or fat-free dairy foods, whole grains like millets, ragi, healthy fats like olive oil. So these are the healthy diet. They should be included in your diet list. Now, one of the important healthy diet that has been studied scientifically is the dietary approach to stop hypertension, a DASH diet eating plan, and the Mediterranean diet. Again, these contain only all the vegetables and fruits, beans and other legumes, as well as lean meat and fish for non-veg, low fat or fat-free dairy foods, whole grains and healthy fats like olive oil. One has to limit the intake of salt, sugar and processed or refined carbohydrates, and avoid drinking alcohol, as well as avoid saturated feed found in the red meat or the full fat dairy products, and the trans fats found in the fast foods, chips and the baked goods. So this is the third component after the 7 top strategies to prevent heart disease. The third component is this. And the fourth one is to maintain a healthy weight. The body mass index should be below 25. 18 to 24 is the normal one. above 25 is considered as an overweight. So please see that you are well within your body weight. That one. The waist circumference can also be a useful tool to measure how much belly fat you have. The risk of heart disease is higher if the waist measurement is greater than 40 inches for men and 35 inches for women. Even a small weight loss can be very, very beneficial. Reducing weight by 3 to 5% can in fact decrease, can have decreased certain fats in the blood. Triglycerides can lower blood sugar and reduce the risk of type 2 diabetes. Losing even more helps lower the blood pressure and blood cholesterol levels. So maintaining a healthy weight is very, very important. The fifth is to get a good quality sleep. People who don't have enough sleep, they are more prone to be obese, they are more prone to have a high blood pressure, they are more prone to get a heart attack, diabetes, and even for depression. So set up a good sleep schedule, or rather a good sleep hygiene, you call it. Keep your bedroom very dark and quiet. Before going to bed, have a warm water bath and put on loose garments and switch off the lights, and then have a soft cloth over your eye, and you will drift into, it become pitch dark, and you will drift into a very, very good sleep. So getting a good quality sleep is the fifth component of the 7 top strategies to prevent heart disease. The sixth component is managing stress. Some people cope up with stress in unhealthy ways, such as overeating, drinking, smoking and all that, but that aggravates the stress. Stress, in any form, it will be there as long as one lives. There will be stress, and we should learn how to cope up with it. You can have alternative ways to manage the stress. Like you can do some physical activity, or set up some hobby, or you have relaxation exercises or meditation, and these all can in fact improve the health. The seventh one, and the very important component, is get regular health screenings. Check your blood pressure, check your blood sugar, check your high cholesterol level, so that you will know exactly where you stand. Perhaps maybe once in 6 months. That can be done if there is any specific ailment as prescribed by your family doctor. So that is the seventh component of the top strategies to prevent heart disease. Therefore, following are the strategies. 1. Don't smoke or use tobacco. 2. Get moving. Aim for at least 30 to 60 minutes of activity daily. 3. Eat a heart healthy diet. 4. Maintain a healthy weight. 5. Get a good quality sleep. 6. Manage stress. 7. Get regular health screenings, especially noting whether blood sugar is normal, whether BP is normal, and the cholesterol is normal or not. So these are the 7 top strategies to prevent heart disease. Thank you very much.